Imagine waking up one morning with chest pain. Not the, oh, I slept funny kind of pain, but the full-length arm tightening, sweat on your forehead, Googling symptoms you shouldn't be Googling kind of pain. You call 999. Do you expect the ambulance in what, 8 minutes? Because that's the national target for life-threatening emergencies. Except the operator says the words nobody wants to hear. We're experiencing severe delays. And in that tiny moment, every debate about funding, staffing, politics, strikes, reforms, statistics suddenly becomes painfully real. This is the story of NHS in 2025. A system built with world-class intentions that is now fighting for its life. Let's break down why it's struggling, factually, historically, and brutally honestly. Welcome to the series where we try to get you 1% smarter with every video. Let's go. When the NHS was launched in 1948, the average Brit lived to around 69 years old. Today, it's 81. That's great news for birthday cakes, terrible news for hospital capacity. Because people don't just live longer, they live longer with conditions. Type 2 diabetes, heart disease, dementia, arthritis, long-term illnesses that require constant care. The UK population has grown from 50 million in 1950 to 67 million today. But NHS capacity, beds, GP access, diagnostics, nowhere near the same level of growth. It's like expecting a 1950 Mini Cooper to do a 2025 Costco shop. It doesn't matter how good the engine is, it's just not built for the load. And here's a stat that should worry anyone who's ever stepped in an A&E waiting room before. The UK has 2.4 hospital beds per 1,000 people. Germany, 7.8. France, 5.7. The UK just isn't behind, it's in a different league. For decades, the UK deliberately cut bed numbers under the idea that modern healthcare won't need as many beds. Except it turns out it does. When beds are full, A&E backs up. When A&E backs up, ambulance queue outside. When ambulance queue outside, response times collapse. And when response times collapse, well, we're back to the chest pain at the start. This is what experts call exit block. It's not a staffing issue, it's not a funding issue, it's a physics problem. You cannot treat patients if there's nowhere to put them. As of 2024, the NHS had over 100,000 vacancies across England alone. Why? Because the NHS isn't just losing staff, it's hemorrhaging them. Factors like burnout, low pay compared to other countries, relentless pressure all come into play. Between 2010 and 2022, real-term pay for nurses fell by around £5,000. Meanwhile, Australia, the redneck cousin, and that's not racist because I'm a Kiwi, is paying nurses $20,000 to $30,000 more. They're waiving visas and saying, come on mate, we've got better sunshine and better pay. Terrible Aussie accent, I know. Ultimately, the truth is simple. Competitive job market plus lower UK pay plus higher workload equals an unstoppable staff drain. If you've ever phoned your GP at 7:59 a.m, you know the pain. It's like queuing up for a Glastonbury ticket. GPs are dealing with millions more appointments than a decade ago with fewer doctors per patient. As a result, patients flood A&E because they can't get a GP appointment. A becomes overloaded, which pushes more pressure back into the hospital system, which pushes more pressure onto those who are already burned out staff. The whole system is interconnected. When one part falls, so does the other. Now, we must give NH credit where it's due. It's world-class at saving lives, but it's also world-class at paperwork. Some hospitals rely on fax machines. Yeah, fax machines, which I'm sure some generations will have no idea what they are. They're these things for you Gen Z out there. The NHS uses hundreds of incompatible systems that just can't talk to each other. Clinics waste hours every week re-entering the same data, chasing records, printing forms, scanning forms, and emailing forms. So now, NHS doesn't just have a staffing problem, but has a problem with the systems that it has in place as well. This part is the one that probably no one sees, but is probably the most important piece of the puzzle. Right now, tens of thousands of hospital beds are occupied by people who are medically well enough to go home, but can't leave because there's no social care package available. So those patients wait, and while they wait, new patients can't be admitted. And when new patients can't be admitted, A&E fills up. And when A&E fills up, ambulance queue outside for hours. Social care is a dam upstream. When it cracks, the river floods. And unlike NHS, social healthcare isn't free. It's the missing half of the healthcare equation. And speaking of equations, let's talk numbers. People love shouting that the NHS budget is bigger than ever. Technically, that's true. Nominal spending has gone up. But after adjusting for inflation, population growth, and rising medical costs, real terms spending increases over the past decade were half of what they were between 2000 and 2010. Think of it like getting a £5 pay increase while your rent, electricity, your delivery costs go up by 20%. You're not richer, you're slightly less underwater. Meanwhile, countries like Germany and France consistently spend a higher percentage of GDP on healthcare. The UK sits below the EU average. And where the money goes matters too. The NHS is insanely good at emergency medicine. Heart attacks, strokes, trauma, you're in the right country. But prevention, early detection, keeping people out of hospital, the UK underinvests massively in these areas. Public health budgets were cut by 24% between 2015 and 2021. Underinvesting in preventative healthcare measures results in demand for reactive healthcare measures being much higher. And when was the demand for reactive healthcare the highest in the world? The COVID pandemic. Now let's be clear, the pandemic didn't break the NHS. It exposed what was already cracked. Before COVID, waiting lists for appointments were around 4.6 million. Today, they're hovering around 7.6 million. To put that into perspective, that's the entire population of London waiting to be seen by a doctor. Now to be fair, the NHS actually increased productivity post-pandemic. They did do more appointments, more surgeries, more activity, but demand blew past supply like Verstappen overtaking a child on a scooter. And this leads to our first brutal truth. You can't clear a backlog the size of a small country when your workforce is exhausted. Your bed numbers are European basement tier and half your buildings are falling apart. And I'm not saying that metaphorically. Some of the buildings are falling apart. More than 30% of NHS buildings predate the 1980s and many are described as not fit for purpose. As of 2024, the NHS had 11.6 billion in required maintenance work that it couldn't afford to do. That includes things like cracked roofs, leaking pipes, broken lifts, outdated theatres, and no joke, reinforced, autoclaved, aerated concrete. The stuff that's known to crumble without warning. Yes, some NHS hospitals have the budget version of concrete. The concrete that you wouldn't even trust building a garden shed with. This basic infrastructure just adds to the ever-growing list of problems. Operation gets cancelled, wards close, ambulances get diverted, and now you're going to a hospital with the fear of having a few more limbs broken on top of your heart problems. Since the year 2000, the NHS has gone through multiple top-down reorganizations, each one sold as a revolutionary fix. Instead, every time leadership structures change, everyone loses clarity, accountability, and months, sometimes years of productivity. The 2012 Health and Social Care Act reorganized the NHS so aggressively that even senior staff couldn't explain the new system. Every new government promises the same thing. We'll fix the NHS and then open the toolbox and pull out a rebrand, a restructure, and a press release. The truth is, healthcare needs long-term planning and politics works in 4-year windows. In 2035, 1 in 4 Brits will be over 65. And here's the kicker. Around 1/3 of NHS nurses are already over 50. Meaning, the NHS is heading towards a retirement cliff at the exact time that demand will surge. If that sounds bad, remember, it takes 3 years to train a nurse. It takes a decade to train a specialist doctor. You cannot hire your way out of this problem with few flashy recruitment ads. This is a slow motion train wreck that started 20 years ago. So, why is the NHS struggling? Because everything that could break, broke at the same time. An aging population, chronic underinvestment, staff shortages, collapsing social care, outdated infrastructure, poor political planning, rising demand, and a workforce at breaking point. It's just not one problem, it's the Avengers of problems assembling all at once. And yet, despite everything, the NHS still continues to perform miracles daily. That's the insane part. It's failing systematically, but succeeding individually. Doctors, nurses, paramedics, carers, they are doing superhuman work inside a system that's running on fumes. So what actually happens next? Let's talk solutions, and real ones, not the ones you'll see on some press release by a politician. But first, a reality check. There is no magic fix. No single reform, no shiny new app, no heroic prime minister who jumps in and shouts, "I've solved healthcare." like it's a Sudoku puzzle. The NHS is struggling because the UK spent 20 years avoiding the hard conversations. So let's have them. For years, politicians pretended that the NHS could keep up by simply doing more with less. Translation: burn out staff and hope nobody notices. But this isn't a tech company where we can lay off workers and the only big expense is monetary. We're talking about people's lives here. The numbers don't lie. The UK has fewer beds than comparable countries, fewer scanners, fewer clinics per capita, and one of the oldest healthcare estates in the developed world. You can't reorganize your way out of physics. You need more infrastructure and more people. The NHS needs physical expansion and not just transformational plans that are written by consultants for £1,200 an hour. This is the biggest political blind spot. You cannot fix NHS without addressing social healthcare. It's impossible. Right now, the NHS loses around 2.5 million beds per year because people medically ready to leave can't get a care package. A functioning NHS needs more home care capacity, more care workers, better pay to attract staff, safe regulated care homes, and consistent national funding, not a postcode lottery. Until that happens, hospital flow will remain blocked. The NHS is drowning because it treats illness brilliantly, but it prevents illness terribly. The UK has some of the highest rates of obesity, heart disease, type 2 diabetes, and avoidable hospitalizations. Let's put it this way. For every £1 spent on prevention, the NHS saves £14 later. If you want fewer people in A&E, the real investment isn't hospitals. It's healthy eating programs, early cancer screening, active lifestyle schemes, mental health support, air quality improvements. Healthcare isn't just what happens inside of a hospital. It's what happens in your everyday life. Now, granted that this is just a simplification and many more factors come into it, like education, but you get the general idea. Training a doctor takes 10 to 15 years. Training a nurse takes 3 years. Training a specialist can take more than a decade. Yet, for years, the UK refused to train enough staff because it costs more money. In 2023, the government finally announced a long-term workforce plan, the first of its kind, aiming to train tens of thousands more doctors and nurses. That's a good start, but it only works if it survives multiple governments, multiple ideologies, multiple economic cycles. Healthcare staffing is like planting an oak tree. If you plant it today, the shade arrives in the next generation. If your plan gets ripped up every time there's a new prime minister, it's pointless. Now, on to the real question. Can the NHS be saved? Short answer, yes. Long answer, yes. Only if we stop pretending everything is fine. The NHS is like a legendary football club going through a rough decade. The fans love it, the players believe in it, the brand is iconic, but the stadium is crumbling. Half the squad is injured and the owners keep promising a 5-point plan while refusing to buy new defenders. This kind of sounds like Manchester United. NHS is Manchester United, and you don't stand united overnight. You unite by rebuilding over a period of time. The NHS still has world-class doctors, universal public support, some of the best emergency outcomes in the world, incredible research institutions, and the ability to innovate rapidly when unleashed. Remember the pandemic? Makeshift hospitals were built in days. A vaccine rollout that outran every major nation was completed. Community GP clinics turning into well-oiled vaccination machines. The NHS is not broken because people don't care. It's struggling because the foundations around those people have eroded. Fix the foundations and the system comes back to life. So here's the truth in one line. The NHS isn't failing because it's free. It's failing because it was never funded, staffed, or modernized to match the world we live in today. It's simple as that. A system built in 1948 still expected to survive in 2025 without the tools, money, or capacity to do it. But the good news? Every problem that the NHS faces is solvable. And in a country where nearly every political issue is split, the NHS is one thing that almost everyone agrees on. We want it to survive, we want it to succeed, we want it to still be here when we need it. Because at the end of the day, when the chest pain hits and the ambulance finally arrives and a team of exhausted, underpaid, unbelievably skilled professionals fight to save your life, you realize the NHS isn't just a health system. It's a promise, a national promise, one worth fighting for. So, if this video made you inspired or at least 1% smarter today, give us a like and subscribe to the channel to keep getting 1% smarter with every video. Until next time, peace.